On everyone. Sorry, we are trying to sort out the next speaker who is supposed to be doing an online presentation. So thank you very much, Dr. Lina. She was one of the doctors who, when they left and she had to go back to her county, I felt the gap. So I'm supposed to be presenting on the clinical and cost benefits analysis of early use of Paliperidone Palmitate in the management of schizophrenia. And we know up to date, schizophrenia is still one of the disabling brain diseases, one of the remaining challenges facing modern medical sciences all over the world, even internationally. And I've picked a study of a 2-year outcome with long-acting antipsychotics in early psychosis. And the results were that the majority of patients received assured the majority of the patients who are receiving assured antipsychotic medication achieved sustained remission after first psychotic episode. When we are trying to choose which antipsychotic to use, we look at the side effects. So in that table, you can see the various side effects. You can see the cardiometabolic changes. You can see prolactin levels. You can see need for fast-acting agents. You can see need for monthly injections and the cost. So those are some of the things we look at. And the product we are discussing today, Paliperidone, you can see it does very well in fast-acting and in having a long-term injection. And I've done a study at Chiromo Hospital Group to look at when Paliperidone Palmitate had been introduced in the country. And we know that registration of Paliperidone Palmitate was done in 2020. And initially we started with named patient importation since 2017 through private hospitals, especially Chiromo Hospital Group. And this study, I looked at records of the 120 patients on the Paliperidone Palmitate long-acting from December 2017 to January 2020. And I'll be sharing what we found out. But we know that since 2013, the monthly Paliperidone started coming into Kenya. I remember 2016, some Kenyans would have to go for it in India. In 2017, it was launched. 2019, then 3-monthly injection was launched. And in 2022, the Bianli, I attended the Royal College of Psychiatrists, and the Bianli is now being used. And from the study I did, we could see marked reduction in hospital admissions after using long-acting injectable Paliperidone Palmitate. There was also reduction in proportion of hospital admissions, and there was also significant reduction in duration of stay after the long-acting injectable antipsychotic. 69.4% had good functional outcome. And to discuss now the topic, the latest research on Paliperidone Palmitate, which was looking at the cost-consequence analysis of a long-acting injectable in the management of schizophrenia in Kenya. We know that world over, and especially in the low and middle-income countries, mental health remains a neglected priority and low on the agenda. Research related to mental health financing is extremely limited and rarely clear. And in 2016, the World Bank, together with WHO, organized a meeting which was named Out of the Shadows, Making Mental Health a Global Development Priority. And part of the decisions that came in from those discussions were that WHO and World Bank insisted that there needs to be an objective to prioritize the need for improved financing for mental health and to support efforts to close the unmet gap. Despite the critical importance of medication, as we've seen in schizophrenia treatment, recent studies are showing that up to 74% of patients discontinue their medication within 18 months. And clinical practice guidelines recommend the use of antipsychotics, especially the long-acting ones, for non-adherent patients. And another study, which the citations are given below my presentations, was that paliperidone palmitate is a okay. Let me just summarize. Showed 30% reduction in first treatment failure, increased delay in relapse by 6 months, and reduced hospitalization during episodes during the duration of the trial. So the study looked at cost consequence analysis. And when we are doing a cost consequence analysis, we do an economic evaluation, assessing a wide range of costs and consequences of the interventions being compared. The direct and indirect costs and a catalog of different outcomes of all alternatives are listed separately and disaggregated in a disaggregated fashion. It allows decision makers to choose the combination of cost and benefits that are most relevant to their context. And it also gives the decision maker confidence that the data is credible to use on the basis for healthcare resource allocation. So the methodology, Equivia interviewed several psychiatrists from the universities, from the government, and from the private sector. And they also looked at insurances like NHIF and private insurances. And the study showed several things comparing the adherent patients and their non-adherent patients. And you can see the elements looked at included the special population with schizophrenia, and those on oral treatments, and the medications which were compared at that time were paliperidone tablets, risperidone tablets, aripiprazole tablets, olanzapine tablets, haloperidol, and amisapride, and those who had already stopped their treatment. And the intervention was the long-acting injectable 1-monthly injection, and the study took a year, and this was 2021. And you can see the clinical inputs. You can look at the annual probability of treatment discontinuation if you are on any of those drugs. And you can see the injection reduces the probability of treatment discontinuation. You can see how the others range. And there's a poster out there which is very detailed and a team to answer all the questions. The next slide is on annual probability of relapse. You can see again annual probability of relapse when you're on paliperidone palmitate monthly injection is lowest compared to the tablets. You can look at the drug regimen cost. That's the costing per milligram. You can see the cost per each milligram, because we are looking at the cost of the medicine and the other associated costs. So the other associated costs include drug administration costs, which you can see as tabulated. You can see monthly monitoring costs and patient distribution. You can see the comparison between private sector and public sector. And then sources were the key opinion leaders, and many of them who were interviewed are here and others are not in today. Relapse management, they also compare the cost of managing a patient who relapsed. And you can see the cost included even monitoring lipid profiles, monitoring liver function, monitoring total blood count, hemoglobin. You can see all those costs tabulated, and you can see the costing in the private sector and in the public sector. And the opinion came from the private sector of facilities, the government facilities, basically Madari Hospital, and also the doctors interviewed from the university, from the government, and from the private sector, and the insurances. Post-relapse management and other costs, you can see they are all put there. Look at the management of side effects, which includes the EPS management, weight gain, and diabetes. Indirect costs and related data. You can see the loss of minimum monthly wage, labor force participation, unemployment level, suicide rates, annual productivity. And down there, you can see the costings in private sector, in emergency room visits, and in physician's visits. So I will summarize the results, and on an overview, you'll be able to see the posters there, and I believe we are going to have question and answer. The cost consequence analysis model quantified the health and cost burden to patients and families when using different treatment options for schizophrenia, basically comparing oral and psychotics, and the 1 monthly Paliperidone Palmitate. The time spent on treatment was higher for those who are on Paliperidone Palmitate monthly injection, leading to reduction in cost of relapse and post-relapse care in both the public and private sector, and that Paliperidone Palmitate monthly injection has the potential to reduce costs, and you can see costs comparing those drugs, amisapride, haloperidol, no treatment, both in private sector and public sector. You can see the comparison in the cost, the 489 and 604,000, and the other comparison. In the private sector, the Paliperidone Palmitate monthly injection performed better in terms of total cost compared to amisapride. Among all the comparators, the cost of relapse was least for Paliperidone Palmitate in case of both public and private sector. No treatment for patients who had no treatment, because we say when we are managing schizophrenia, we cannot afford to put people on a placebo or to watch them, because we know if you get relapses, your function deteriorates. So we compared those who had already stopped treatment, even as they were being convinced to come back to treatment, those who are on haloperidol and amisapride, and you can see the comparison there. Similar results were observed for direct cost, which is crucial from patient perspective. The indirect cost was least for Paliperidone Palmitate, both public and private sector, and the indirect cost burden was at least 1.2 times higher than for those on Paliperidone Palmitate monthly injection. So, in conclusion, second generation long-acting injectables, such as Paliperidone Palmitate, improve treatment of and adherence while reducing the frequency of relapse and admission, and can be considered as a treatment option for patients with schizophrenia in Kenya. And that medical insurance can actually fund for the treatment, because when you look at the overall reduction of the cost, you'll see the difference. That is Nairobi Mental Services, which was discussed yesterday. That's where we started in March 2020. And that's where we are now, a level 4 hospital, accredited by NHIF and other insurances. Thank you very much.